Restless leg syndrome is a common neurologic condition that appears for some reason more frequently in Western civilizations than in the East. In this video, we'll take a look at RLS or restless leg syndrome, its etiology, and its possible treatment. Restless leg syndrome is a common neurologic disease that presents with an uncontrollable urge to move the legs or walk, especially after sitting down or lying down. The symptoms are usually worse in the late evening and in the night, and are relieved by walking or moving the legs. On rare occasions, these symptoms can present in other parts of the body apart from the legs, such as the face or the mouth, or the neck or the arms, or the abdomen or the genitalia. If these symptoms are present in the absence of other diseases that can possibly explain them, such as damage to the nerves or pooling of blood in the legs, then a diagnosis of RLS can be made. Restless leg syndrome occurs more frequently in women than in men, and in people over the age of 40. Restless leg syndrome can be put into two categories: primary and secondary RLS. Primary RLS has a strong genetic association, and over 50 to 60% of people who have RLS report first-degree relatives who suffer with the same symptoms. Secondary RLS is RLS that appears in a setting of iron deficiency, ADHD or attention deficit hyperactivity disorder, chronic renal failure, or in pregnant women. Researchers believe a dysregulation of the dopaminergic system in the body is the underlying cause of restless leg syndrome. Dopamine is a neurotransmitter that is made in the brain and that has multiple functions in the body, including the control of movement. Iron is somehow associated with the function of dopamine in the body, so that in cases of iron deficiency, people can develop a dysregulation of the dopaminergic system and go on to develop RLS. Because of the link between tissue iron and the function of dopamine, one of the first things providers would do is supplement iron if the level of iron in the blood is low. Thereafter, they would go on to prescribe drugs known as dopaminergic drugs, which are drugs that mimic the function of dopamine in the body, like pramipexole. Or they may prescribe other drugs such as gabapentin, which are drugs that control the neurons that produce dopamine in the body. Opioids are another class of drugs that providers would use if these first two classes prove to be ineffective, or if people develop what is known as augmentation, which is a worsening of the symptoms of RLS while the patient is taking dopaminergic drugs. Providers would also recommend lifestyle changes such as better sleep hygiene and moderate exercise. Finally, there are nerve stimulating devices that are currently being evaluated as potential treatments for restless leg syndrome. I hope you enjoyed the video. If you did, like, share with friends and family, and leave your comments in the box below. Don't forget to subscribe to the channel to support the channel. Thank you for watching. I'll see you in the next video.